Welcome to the channel. Are you ready to master your content and be able to answer questions in the flawless way using concept? This video is for you, to challenge you, to test you, to help you master the content regarding your critical care nursing exams. Let's get to it. First question, as you can see, these board exams is specific to design you. It's an advanced level. You're already a nurse. They want to trap you. They want to confuse you. Don't worry about it. You got it. Look at the question, go for the buzzword. There will be a bunch of information. You can ignore most of them and simplify the question so that it can make sense to you as you're taking care of a patient. Think about it as if somebody is giving you a report and you just write the key aspect of the question. Which of the following is the most likely cardiac rhythm, and what is the most appropriate initial intervention? Two questions in one. Make a diagnosis and treat it. Okay, what is the problem? A 60-year-old male present to the ICU from his primary care provider's office after complaining about what? Lightheadedness. So one symptoms. The first portion, I don't care. He has no past medical history. Eliminated. No other problem. And state he has not seen a doctor in many years. That means he has medical problem. That's the key, right? On assessment, he appears pale. He may be anemic or diaphoretic, right? Something is not right. His temperature is okay. His heart rate too high, 140. The blood pressure is still stable with a map of 60, greater than 67, greater than 60. Respiratory and SAT are okay, but SAT is going down, right? It's 92 on Rome, even though it's normal, but normal people should not walk around with SAT of 92. What does the EKG show? That's the key. What does the EKG show? Irregular RR interval and the absence of what? P wave and narrow QRS complex. These alone give away the answer, and you should be able to master and figure out what this rhythm is. You should be able to be very comfortable when they give you EKG without a reading, but they give you the description of the EKG. So there's irregular RR interval. That means the RR interval from one R, okay, to another R, the distance are not the same. You have something like that, right? Something like that. And basically from R to R are not the same. And there is no P wave. So what you have is something in between the RR interval. You can't see anything. This is consistent with, and it's narrow QRS compress. It's not the wide one. What do you think? It's 60-year-old, no medical problem, but it's tacky to 140, and he has irregular rhythm with no P wave and narrow compress. This is classic what? Atrial fibrillation, right? This is supraventricular tachycardia is wrong. Why? Supraventricular tachycardia is from the what? Above the ventricle, fine, but you should have an atrium, a rhythm. The atrium will be buried in the ventricle, but it does not matter. The atrium will be buried in it, but it does not matter because they don't have time to, or the atrium will be buried in the T wave. You get closer, but there's no time. It's so fast, right? This is the key. So it cannot be supraventricular tachycardia. Atrial fibrillation is classic with the rapid ventricular response. Why? Because it's 140. Ventricular tachycardia is going to have wide complex QRS. So I'm not looking at anything. I'm just looking at a V tag, and I know it's a wide complex, not narrow complex. And sinus tag, there's always a P wave, right? Absence of P wave, defeat that. And this is the way you can break, no matter how long the question is, guys, you got it. So number 2 is the right answer. So what next? Same strategy. Read it from the back. Figure out what is going on. Make a diagnosis and fix the problem, right? Which of the following cardiac chamber pressure is most likely, right, to be elevated? Most likely to increase. A 75-year-old male patient was recently diagnosed with what? Aortic stenosis. This is the heart. The aorta is taking things from the ventricle, left ventricle, and thus it's stenosis. That means pressure here going to the aorta has to be higher than the aortic pressure. Echocardiogram shows what? Left ventricular hypertrophy. It's not, you shouldn't be surprised because we need to generate enough pressure in the ventricle to overcome the aortic stenosis, while right ventricular size is normal. So this side is normal, right? And function are normal on the right side. As part of the perioperative workup, he undergoes echocardiogram, right heart catheterization and left heart catheterization. Look, bunch of information. All the question is asking you, go for the buzzword. You see, I underline only one word. I'll add this one and the right ventricle. So aortic stenosis, left ventricle hypertrophy, and then right ventricle size is normal. I'm asking you what pressure I'm giving you should be elevated, right? This is the pathophysiology. We have stenosis in the atrial, aortic stenosis, right? The ventricle, left ventricle has to push against it. In the process, left ventricle get thicker and thicker and thicker. So left ventricle hypertrophy. If this continue, then everything will back up to the left atrium. The left atrium also pressure increases. So you have increased refilling pressure in the left atrium. If this continue for a long time, you go to the lung, you have wedge pressure is going to go up, right? You continue, and if you continue, you go to the right side. But the question telling you the right side is fine. If the right side is okay, then the right atrial pressure is going to be normal, right? If the right side is okay, there shouldn't be anything related to your central venous pressure. For the pulmonary artery pressure to increase, the left atrial pressure has to increase first. So this is the test-taking strategy, right? You have to put it together. So aortic stenosis will lead to what? Increased left ventricular systolic pressure and the left ventricular hypertrophy. These will elevate the end diastolic pressure in the left ventricle. And over time, the increase in pressure is transmitted backward into the left atrium. And this is going to cause the left atrial pressure to increase. As this continues for a long time, the pulmonary artery diastolic pressure will increase. For now, the best answer choice is the left atrial pressure. So these are the ways I want you to think about the question. And I know you know it because you watch Adapting class. The next one is this. It's the same thing. Let's use the strategy we have. Read it from the back, find the keywords, the buzzwords, and figure it out. Which of the following intervention is what? Inappropriate in this situation? That means doing something wrong. 75-year-old female is admitted from the emergency department with the third-degree heart block. He has third-degree heart block due to what? Accidental beta blocker overdose. So he took a lot of beta blocker and it had stop. And temporary pacemaker is inserted. On monitoring, some pacing spikes are not followed by the QRS complex. Those are the content, underlying buzzword. Transition them into a question. At your stage, these are the ways they want you to think. A temporary pacemaker placed, but on monitoring, some pacer spikes are not followed by the QRS complex. That means it's not being captured. That is what it means. Failure to capture is the key. So when you see pacing spikes not followed by QRS, it means it's not being captured. So, but in actual fact, every QRS should be expected to give you a response of the ventricle. So that's the key word. A failure to capture means the pacemaker is firing, but the myocardium is not responding. So that's why it's not being followed. What are the appropriate steps to take, right? Most of the time, if this is happening, there's something wrong. You need to increase what? The output. That means more energy, right? Boost the electrical stimuli strength. So increasing the pacemaker output will help with the capture. Maybe the catheter is a display. So repositioning the catheter may help improve contact with the myocardium and be able to fire better. Calcium, with calcium chloride is very, very important. It counteracts beta blocker effect. The side effect of the beta blocker, calcium chloride can counteract it and then improve myocardial responsiveness. That's why you have to give IV calcium. So the beta blocker overdose, you can use calcium chloride to help with that. Why D is the wrong answer. So this is decreasing the pacing sensitivity. It's a problem because if you decrease the sensitivity, that means you raising the MV setting. It makes the pacemaker less responsive to intrinsic electrical activity. So that's why. But what does it do? This the pacing sensitivity actually affect what? Sensation, not capturing, right? So adjusting sensitivity is irrelevant in this. I mean, it's not going to help you anyway. You don't need to do that because those are not what is a appropriate situation. What I mean, we have a capture problem. Therefore, do the things about capture. Decreasing pacing sensitivity, it means you think the patient has what? Sensation problem. That's all. Failure to sense. This is not failure to sense. This is the failure to capture. Therefore, doing that is inappropriate. This is Adapting Chris. 3 questions, mastering. I hope you learned something. Good luck and subscribe to Adapting Chris for more content like this. Take care of yourself.